Good evening, ladies and gentlemen. Good afternoon to some, good morning to others. If you're going to be joining us via the recording, my name is Brian Louis, and I'm so very excited. I'm so happy and I'm so grateful for every single person that made it here to tonight's amazing presentation / training. You know, tonight we have one of our superstars in IMMERI. This is a gentleman that has really helped a lot of people to capture the vision of IMMERI. He is Dr. Kan Kok Ming. He is the director of the IMMERI Growth University. And tonight we're going to have an amazing session. I encourage all of our guests and all of our members, I encourage you to pay very close attention tonight, because Dr. Kan is going to share how to become an irresistible woman. And I know in the Caribbean, we have a lot of irresistible women already. so I know we don't have to do a lot, but I know Dr. Kan is going to come and join us and share some amazing nuggets about our incredible flagship product, Vagine. And so without further ado, I want to thank you so much, Dr. Kan. It is now, I believe, 8 a.m. where you are. So I want to thank you so much for getting up a little bit earlier to join us for today's presentation / training. And so, ladies and gentlemen, I encourage you to put your questions into the chat box so that Dr. Khan will be able to take all of your questions, as well as you will have an opportunity to raise your hand and unmute, and you will be able to ask Dr. Khan your questions directly. And so without further ado, ladies and gentlemen, I introduce to you an amazing gentleman. As I said, someone that has connected all of the dots for so many people in our entire IMMERI family. I present to you the director of the IMMERI Growth University, Dr. Khan Kokming. Dr. Khan, over to you.
Thank you, Mr. Brian. Good morning, good evening, everyone. This is 8 a.m. in Malaysia, but I believe right now is 8 p.m. in Trinidad, right?
Yeah, that's right. That's right.
So thank you, Mr. Brian, and thank you for having me. And it's my pleasure to meet all of you. All right. So before I proceed, let me just share my PowerPoint.
Yes.
Okay. Can you see my screen?
Yes, we can see it now.
All right, thank you. Yeah, I feel very excited because Mr. Michael, they told me about how amazing our IMMERI in Trinidad, and I believe today is it will be an amazing day because I'm very excited to meet all of you. All right, so once again, and good evening to everyone. And as I mentioned by Mr. Brian, so today I'll be sharing a topic on how to become an irresistible woman. And before I proceed, may I know how many of you are female here? Because I have no idea, what will be roughly the percentage. So if you are female, can you please just put 111 in your chat box so that I can roughly know how many of you are women, are female, and how many of you are male?
Dr. Khan, we are in the minority.
Well, that is well, it can be a good thing because all right, thank you. I can see many 111, so it means well, I think the women's are majority. But anyway, all right, thank you for your response. So no matter what gender you are, and tonight I'm going to share with you this. And for the ladies, you are holding the secret to be irresistible. And are you excited? And for the gentlemen, as I said, you are holding a key to turn the woman to be irresistible. And not only that, you are even holding the power in making a happy marriage as well as happy family. All right, so are you excited to know more? All right, so let me just proceed. And in order to be irresistible, we must first understand what makes women irresistible. And of course, there are many qualities involved. And out of the many qualities in many surveys, I managed to summarize the few most important qualities that a woman must possess in order to be irresistible. And let's look at the slide. All right. So as I said, to be irresistible. Oh yeah. Before that, bear in mind, I'm talking from physiological aspect in scientific perspective. Of course, when you're talking about this, all these things, sometimes, people will say this actually involves psychology. But as I said, since today we'll be talking on the gene, and I'm actually talking from this physiological aspect. All right. So the number one criteria or number one quality that the woman must possess is she must be confident in order to be irresistible. And of course, you must be asking, how is confidence related to virgin? And let me ask you this. Do you think women will feel confident if they are suffering from foul odor, vaginal itching? Definitely, it will definitely affect their confidence, no matter how nice they dress up. And in fact, this gynecological discomfort always lead to psychological distress as well. And let me just show to you one article. So I managed to find this in one of the psychology journal. And in this journal, it actually did mention about this how our this gynecological discomfort related to the psychological distress. And as mentioned here, Gynecological conditions by their nature are likely to be accompanied by impairment in social, occupational, and personal functioning. And, you know, as I keep on saying, if this gynecological discomfort or this gynecological problem, if actually left untreated, so it will actually affect our confidence as well as our social functioning. All right. So the number one criteria that the woman that need to have is definitely confident. All right. And number two, she must be always cheerful. And again, let me ask you, as the gentleman, or even though you're minority, and let me ask you this: do you like a moody wife or girlfriend? So I bet no one will like that, right? And do you know that one of the factors that actually affect their mood is actually their sex hormone? I think a mood swing is always noticeable during their menstruation and as well as during the menopause. And this sex hormone, by the name estrogens and progesterone, are produced in the reproductive system. It means if your reproductive system is healthy, your hormone excretions will be stable as well as your mood. And again, I managed to find another articles, another journal that clearly say that our mood disorders and the relations with the reproductive cycles. So during the reproductive cycles or during the menstruations, the fluctuations in the hormone actually affect our mood. And that's the reasons why, you know, some of the women, you know, when their menstrual cycles are in a stable state, definitely they will, you know, they will feel happy, or their emotions are stable relatively if compared to those having a hormone imbalance. Which means, so if you want to be irresistible, and number two quality that you need to have this stable mood. You need to feel happy, and in order to do so, you need to have this healthy this reproductive system as well. All right, so this is the criteria number two. Let me move back to the number three criteria. And number three, and I believe to the gentlemen especially. All right, so this will be the most important the criteria. And this woman, if she wants to be irresistible, she must be attractive. All right, I know attractiveness is very subjective, but do you know that our attractiveness is also affected by a hormone called pheromone? And following, you will keep, you know, listening to these terms called pheromone. And pheromone is actually a special hormone. All right, and of course, even though, you know, the presence of a pheromone is still debated. And also some scientists, they said the pheromones only appear in the animals, but actually there are also many studies showing that humans do excrete the pheromone. And the good news is pheromones also present in vaginal secretions in the form of short-chain fatty acid. And let me show to you this journal, these articles again. And of course, you know, the journal is quite lengthy, but I just want to show to you something, you know, very special and something related to us. And according to this journal, it shows here our vaginal secretions in the forms of this short-chain fatty acid. It's actually, it can actually, you know, it contain the pheromone, and this pheromone by the names of corbulins can actually influence the physiological and the psychological behaviors of opposite gender, which means if you excrete a sufficient of pheromone, you will be able to attract the opposite gender. Particularly, I mean, this is very important, I believe, to the women. If you excrete sufficient of pheromone, you will be very attractive in the eye of the man. All right. And also that is the reasons why usually women seems very more attractive during ovulations, because according to the studies, you know, the women excrete more pheromones during the ovulations. And these are the factors that actually, you know, makes a woman more irresistible. And as you can see, all the qualities that I mentioned are actually associated with our reproductive system, which means women can remain attractive and irresistible if their reproductive system is healthy. You see how important is virgin, all right? And however, on the contrary, women are commonly suffering from vaginal condition, especially bacterial vaginosis, all right? And you know, bacterial vaginosis is so common that almost, this is a rough estimations, globally there are about 40% of the women suffer from this bacterial or any kind of vaginosis in their life, at least once in their lifetime. All right, and when you're suffering from this vaginosis, and this has actually taken away all the qualities that I mentioned earlier. As I keep on mentioning, you know, this in order to be, you know, in order to be irresistible, you need to be confident. So when you have this vaginosis, definitely you will not feel confident, as well as other quality like, you know, this you know, mood swing, you know, or this attractiveness, it will definitely be affected. All right, and why is it so? I mean, why is this bacterial vaginosis so common? And let me today show to you some these technicalities of this, you know, this anatomy and physiology. All right, if you look at the diagram here, anatomically, the vagina is actually located in front of the rectum and behind the urethra. And as you know, these two organs are full of bacteria. I believe you can find where is the vagina, right? All right, so this at the back is actually the rectum. So in the front is actually there's a urethra, all right? So the vagina is located just in between these two major organs. And as I said, these two organs are full of bacteria, which means the bacterial invasion is very common. And from time to time, you know, the bacteria will try to invade into the vagina. And that is also the reasons why, you know, this bacterial vaginosis, the vaginal infection is so common. And of course, to understand further, let's zoom into the major organ in the reproductive system. All right, so every one of us, we know that the reproductive system comprised of two major organs, which is the ovary, the uterus, and the vagina. All right, and for us to understand further, or maybe let me ask you this. I'm not too sure whether you know well about your organ. Let's answer these questions, and I'll be able to know whether or not you understand or you really understand your organ. All right, so let me ask you this. What is the functions of ovary? You can put your answer in the chat box and let me know whether you really understand the functions of it. So what is the functions of ovary? I believe this is quite simple. I think all the women, they know the functions of ovary. I still haven't seen any produce egg. Correct? Yes, correct. The ovary functions is to produce egg for fertilizations, and at the same time, the ovary also in charge of producing sex hormone, particularly estrogen. So we all know that estrogen is also related, you know, to many functions in our body, and that is the reasons why, you know, women after menopause, that tends to have higher risk of this cardiovascular disease, you know, this osteoporosis. All these functions is related to the estrogen, which is produced in ovary. All right, very good. And what about uterus? What is the functions of uterus? Questions number 2. What is the functions of uterus? You know, sometimes the gentlemen may understand better than the women. You can put up your questions. Just put your questions. I mean, put your answer in the chat box. What is the functions of the uterus? All right, the uterus. All right, to hold baby. Correct. It's actually a place for us to nurture or develop the fetus. All right, so every one of us, we know that. Last questions, and in fact, this is the most important questions, and I've been, you know, asking the same questions in many parts of the world, and none of them give me the correct answer. And today, I'm going to ask you this. What is the functions of vagina? What is the functions of vagina? This is a a very tricky questions because as of now, no one answer correctly these questions. What is the functions of vagina? It appears to be one of the major organs in the reproductive system. For reproduction, well, the passageway for blood, all right, passageway for blood and mucosa, all right. Thank you for the answer. Well, it's quite general. It's quite general. All right. Some say that so it actually provide the passageway for childbirth, you know, or for the let's say for childbirth. All right. If let's say if you think this vagina is for the passage of childbirth, what about the cesarean? You can still deliver the baby by cesareans, right? So if the answer is yes, definitely that is not the major, it's not the major function. Of course, some said, you know, it's actually for passage of the blood. Well, yes or no, but I still think the functions is more important than that. All right, let me give you the answer. Actually, the main function for vagina is to protect the uterus and ovaries from bacterial invasion. As I mentioned earlier, the vagina is located in front of rectum and this at the back of the urethra. And bacterial invasion is so common. Just imagine if the bacteria go into the uterus, what will happen? Do you think we can still conceive a baby if the bacteria invade to the uterus? And what happens if the bacteria go into the ovary? Do you think we will still be able to produce healthy egg or this sufficiency of estrogen if the bacteria go into the ovary? The answer definitely is no. So in order to protect the uterus and ovary from entering into the uterus and vagina, we need a very strong defense mechanisms. And that is the true functions of a healthy vagina. All right, I hope you understand what I mean. All right, so a healthy vagina is very important if you want to have a healthy uterus and also healthy the ovary. All right, and having said that, we need a healthy vagina. So what is a healthy vagina? We need to understand what is a healthy vagina in order for us to keep it or maintain as a healthy state. All right. So a healthy vagina actually requires two very important factors. All right. Number one, it has to be at the right pH. Let me again ask you these questions. What is the right pH for a healthy vagina? Please give me your answer, please. You can put your answer in the chat box. You know, as I said, you know, I asked the same questions to many women around the world, and very little of them give me the correct answer. Okay, 7, pH 7. Well, no. Well, 3.8. So you must have attended our lecture before if you give the correct answer. 3.8 to 4.5, 4.5. Well, not bad, not bad. Okay. All right, so let me give you the correct answer. The right pH is actually between 3.5 to 4.4 or 4.5, which is slightly acidic. You have to remember this figure because I'll be mentioning this later. And once I explain to you the importance of the pH, you understand why this pH is so important. You have to memorize this figure 3.5 to 4.4, which is slightly acidic. All right, so this is a primary criteria for a healthy vagina. And number two, a healthy vagina also requires sufficiency of beneficial bacteria, namely lactobacillus. You know, there are a lot of these good bacteria in the vagina, and one of them is lactobacillus. And this lactobacillus play a very important role in maintaining the healthiness of the vagina. And this lactobacillus serve actually as something like the army to safeguard the vagina. And of course, in order for these lactobacillus to live in the vagina, they require the right pH, which is 3.5 to 4.4. All right, which means if you are providing the pH as a 3.5 or 4.4, it's actually favorable for the growth of the lactobacillus. And when you have sufficient of lactobacillus, and this lactobacillus will produce all kind of natural antimicrobial properties in the vagina to protect or to inhibit the growth of the pathogens. All right, and at the same time, if you have sufficient of this lactobacillus, it will also excrete other things like bacteriocins or the peptide, to kill off the bacteria. So that is the reasons why you need to have the correct pH, and you need to have the right amount of this lactobacillus. And in fact, and this pH is so important, and this bacteria is so important that when you have sufficient of this lactobacillus, it can actually reduce the risk of herpes simplex virus, which is one of the cause of this genital warts. And even HIV in certain journal is actually stated that when you have sufficient of lactobacillus, it can even reduce the risk of getting infected by this HIV virus. And I believe you have heard of this HPV virus. And according to certain studies, if you have sufficient of lactobacillus, it will also reduce the risk of getting infected by this HPV virus, which can cause the cervical cancer. All right. So these are the two very important criteria for the healthy vagina. All right. And of course, in order for us to understand further about this defense system, we need to also study deeper about this bacterial vaginosis. All right. This vaginitis or vaginosis. All right. And bacterial vaginosis is actually a types of vaginal inflammation caused by the overgrowth of bacteria naturally found in the vagina, which actually upset the natural balance. All right. And why women are still very prone to this bacterial vaginosis? What is the reason behind? All right. So let's say there are actually a few causes that cause this bacterial vaginosis. All right. Bear in mind, when I say bacterial vaginosis, is a general this nomenclature, meaning that the vaginosis can be caused by bacteria, can be caused by fungus, can be caused by this trichomonas. But generally, a bacterial infection is the most common. All right. So following is the causes of this bacterial vaginosis, and number one is the unprotected sex. All right. So just now we keep on mentioning about the pH of the right vagina, which is 3.5 to 4.4. All right. And the semen, the pH is above 7. Sometimes it can go to 8, and which is alkaline. So when you have this unprotected sex, it can actually alter the pH of the vagina and promote or encourage the growth of certain bacteria in the vagina. All right. So this is one of the reasons. And number two is antibiotics. Whenever you have these infections, you have this vaginosis, one of the things that you do, you will go to see a doctor. And for doctors, usually they will prescribe antibiotics. No doubt, antibiotic is good in killing the pathogens or the bad bacteria. But the problem is that it will also at the same time kill off the good bacteria. And as I mentioned here, these drugs will kill not only the bad bacteria that cause the disease, but also the good bacteria that you need to maintain a healthy, more acidic vaginal pH level. In fact, according to certain studies, antibiotic kill off the good bacteria more than the pathogens. And if you use antibiotics in a long term, it will actually harm the vagina. And I still remember when we first did the medical conference in Ghana, after presenting all the data to the medical doctors, and one of the doctors actually stood up and he said he himself is actually a gynecologist, and he had to admit that he actually prescribed these antibiotics to many of the patients, and sometimes when this patient keep on coming back, he has nothing, nothing can be done, because the patients tends to have this the bacteria tends to have this drug resistant, and up to the extent that the antibiotics can no longer be effective to certain bacteria. And that's the reasons why when he met with this virgin, he was very excited. All right, so antibiotics is the second causes. All right, and number 3, the dosing. All right, and in fact, this is the most common mistake. The douching is actually, it's either you do the douching with a certain fluid or with the water. It will actually increase. This is not the right method. It will actually increase the vaginal pH level, and this will actually increase the growth of the harmful bacteria. Why is it so? Let me ask you this: if you do the douching with the water, the tap water, do you know what is the pH of the tap water? If you check, the pH of the tap water is roughly about 6.5, all right, 6.5 to 7, which is very close to alkaline. Just now I did mention the pH of the vagina. If you keep douching the vagina with the tap water, it will definitely alter the pH of the vagina. All right, so douching is not the right way. And lastly, the menstrual periods. During menstruations, we tend to discharge the blood, and the pH of the blood, the menses, is roughly about 7.35 to 7.4, which is still alkaline. All right, so when that blood actually flow through the vagina and is absorbed into a tampon or pad and sits in place, it can raise the pH in the vagina. And when the pH is altered, so it will only favorable for the growth of the bad bacteria instead of good bacteria. And these are the reasons why bacteria these women are very prone to this vaginosis. All right. And whenever you have this vaginosis, there are a few few common symptoms. And number 1, you will have this excessive of this discharge, whether it's a thin, gray, white, or this green vaginal discharge. All right, and it will follow by the foul smelling or fishy vaginal odor. So how do we actually know whether or not we are in the state of infections? So this is one of the common symptoms. You tend to have this foul smelling. And as I mentioned earlier, if you have this small smelling, how can you be confident if you are emitting this odor? All right, and you will even have this vaginal itch, and this itchiness is sometimes is really unbearable to certain female. I did receive a call, in those days when we first promote this virgin in Malaysia, in the middle of the night, one of the distributors called me. She said, her customer, after using virgin, it was so it was so itchy that she can't actually bear with the itchiness, and in the middle of the night she called me and she asked me how to deal with it. All right, so vaginal itchy, sometimes it can really be it can be very intense, that is unbearable. All right, and burning during urination, and this is also very common. All right, so all these severe problems actually starts at the vagina. And not only that, what will happen is that if these symptoms or these problems left untreated, it will actually leads to more severe problems. And one of the problem is cervical erosion or cervical cancer. As I mentioned, this HPV virus, human papilloma virus, and human papilloma virus, HPV, according to the research, HPV is the major cause of this cervical cancer. And this cervical cancer is caused by this virus called HPV, which means if you're infected with the HPV virus, your chances of getting the cervical cancer will be very high. And the good news is that if you have a healthy vagina, it will actually, in a way, to protect your vagina from these infections from the HPV virus. All right. And number two, if this bacterial vaginosis is left untreated, it will also lead to abortion, infertility, and even premature baby. And in fact, this infertility is also very common. And I did receive some testimony from Ghana, whereby our doctors in Ghana actually he used to be a doctors in this IVF, in performing the IVF. All right, and he said after he recommend the virgin to the patient, the chances of these patients doing this IVF, the chances for them to conceive a baby, there's even increased a few fold. All right. So this vaginosis can also cause abortions, infertility, and premature baby. And sometimes it will also cause this ectopic pregnancy, the pelvic inflammatory infections, and of course this infertility. All right. So sometimes it will also leads to ovaritis and ovarian cysts. So these are the risk factors of this vaginosis. All right, and that is the reasons why we come out with this patented products, namely Virgin. All right, and Virgin is the only patented product that can balance the microbes in terms of promoting the friendly bacteria, inhibits the bad bacteria, and also enhance the self-defense system in the female reproductive system. And you see, this is a very unique product because you can easily find product for every part of your body. For instance, shampoo for your hair, skincare for your skin, and the list goes on. But you can hardly find something for the vagina. And what Virgin does is that, number one, it helps to enhance the beneficial bacteria. Lactobacillus particularly. Lactobacillus is very important, and we need to have sufficient of lactobacillus. And Virgin, with the ingredient that we added, is able to enhance to growth or to promote the growth of the beneficial bacteria lactobacillus. Later, I will show to you what is the ingredients in Virgin that helps in promoting the growth of the beneficial bacteria. And number two, it also has this anti-pathogens property. And bear in mind, antibiotics also has the similar functions. But the thing is that antibiotic, it will also kill off the good bacteria. Whereas for Virgin, it has the anti-pathogens property. It kills off the pathogen without harming the good bacteria. I think this is very important, and this is a very important point. All right. And number three, it can restore the acidic environment in the Virgin. If you use a pH, this a paper, you check on the gel of Virgin, you check on the pH. The pH is definitely between 3.5 to 4.4 because we actually run through a lot of quality control to make sure that the gel is in the right pH. And as I keep on mentioning, this right pH is also very important because we need to create favorable conditions for the growth of the good bacteria, which is 3.5 to 4.4. And if you happen to have these infections, or you're suffering from this vaginosis, definitely your pH is not at the right right pH. And by inserting or by using this Virgin, it can help to restore the acidic environment. All right. And number four, it also helps to repair the tissue in the reproductive system and eventually recover the immune defense in the vagina. Also, all right. So these are the functions of the Virgin. All right. So following, these are the ingredients that make Virgins such a wonderful such a wonderful functions. And number one, in Virgin, we have this antibacterial and immune peptide. All right, so these are the natural antibacterial and immune peptide that actually produced by the lactobacillus in the vagina. So it will only inhibit the bad bacteria without harming the good bacteria. All right, and it is also added with the organic acid. Organic acid, this is a natural organic acid. And with this organic acid, it helps to restore the pH of the vagina. And it's also added with the seaweed extract because according to certain studies, this seaweed extract also possess this antibacterial property. And most importantly, you have to remember, we also added with this hyaluronic acid, and this is a very powerful ingredient because this is a thing that make the man happy. All right, later I will explain to you why. Because this hyaluronic acid can repair or to reverse the vaginal atrophy. You know, whenever we have this lesser amount, we actually decline in the estrogens productions. Our vagina, literally speaking, it will become thinner and thinner. And with the usings of hyaluronic acid, it helps to restore the thinnings of the epithelial wall. All right, so this hyaluronic acid is the things that actually make us, you know, the moisturizing, which has this moisturizing and tightening effect. All right, and also it's added with the polysaccharide, and this polysaccharide is the food for the good bacteria. By adding this polysaccharide, it's actually like feeding the bacteria with the right food. All right. And also we added this with vitamin E and also the 100% natural essential oil. So these are the ingredients that we have in the virgin. All right. And of course, for this the virgin, we even conducted these clinical studies in Philippines. All right. And according to this study, a few parameters, or the objective of this study is actually to see what is the effect of the virgins in treating the infections in terms of improving this vaginal discomfort and also improvements of a sexual experience and any possible side effects. So these are the objective of the studies. And of course, a few parameters has been used, such as the itching, burning, hurting, irritation, dryness, and discharge, and also odor. And these are the common problems that we have whenever we have this vaginal infections. So by comparing the before and after treatments in terms of these few parameters, we want to know whether or not a virgin can reduce such a discomfort. And according to this study, the result show that the vaginal discomfort, for example, itching, reduced by 38%, and the burning sensations reduced by 30%, the hurting reduced by 29%, the irritations reduced by 25%, and dryness reduced by 30%, and most importantly, the discharge reduced by 59%, and odor reduced by 57%. And only after the use of virgin for the periods of 2 weeks, which means in 2 week times, so it's able to give such amazing results. And interestingly, we also find that, excuse me, interestingly, we also find that this virgin not only work well on the bacteria, we also compare whether or not this virgin can work on the fungal infections and trichomonas infections. And these three are the major causes of this vaginosis. And again, the result shows that this virgin helps to reduce the bacterial infections significantly by 96%, which means if the infection is caused by bacteria, the effect is marvelous, up to 96%. It also worked well in trichomonas infections. I know the sample size may be not so much, but still, it still works on the trichomonas infections and also fungal infections by 60%. And besides that, the inflammatory infiltrates has also been reduced by 93%. Also, this is the result, the clinical results that the trial that we have conducted in Philippines. And throughout the years, we have been promoting this Virgin around the world, and up to now, Virgin has actually benefited, I think, more than 1 million women around the world. All right. And in fact, we have also, carried out a lot of these trainings, these marketing activities in Africa. Okay. So in summary, Virgin is good in reducing infections by enhancing the friendly bacteria and inhibiting the bad bacteria. So meaning that this can, helps to take away all the discomfort, by women with these gynecological problems. All right. And what about those without infections? I believe you asked me this question. If I don't have these infections, I don't have the problems, do I still need to use Virgin? The answer is yes, because for those without infection, they can still benefit from Virgin because Virgin has a moisturizing and tightening effect. It helps to repair the cells and nourish the ovary. Right? Remember, ovary is a place for us to excrete the sex hormone. All right, it can helps to nourish the ovary, and most importantly, it helps to restore the elasticity of the vaginal wall. And I believe this is very important because it helps to have this tightening and moisturizing effect. Okay, and of course, lastly, with this property, it helps to improve the intimacy experience, and most importantly, all right, it can help you to be more charming and attractive by promoting the pheromone excretions. All right, so by using Virgin, it stimulates your body to produce more pheromones excretions, and by doing so, it helps the women to become more charming and attractive. And in fact, our fellow IMMERIans in Ghana, they said, this Virgin make their wife more delicious. All right, and they even come up with a slogan: a Virgin designed for men, designed for women, and loved by men. So these are the benefits of the Virgin. All right, and there's also this, the recommended the dosage of Virgin. I missed that slide, but it's okay. I just tell you verbally. All right, so the recommended dosage for Virgin is actually like use 1 tube per day for consecutively for 2 weeks, which is 12 days. And day after, you can use on alternate day as maintenance. And of course, but for the severe cases, they may actually prolong the everyday usage and use on this alternate day when the symptoms disappear. All right. And with all these benefits, Virgin can definitely rebuild the confidence in women. And as we are, and every one of us, we are actually granted the power to change their woman life. So the fellow IMMERIans, so please help the women around us and give them a chance to be irresistible again. So I think with that, I will end my presentation. So okay, we can spend more time on the Q&A sessions. All right, so with that, thank you very much. Thank you. I'll pass it back to you, Mr. Brian.
Wow, thank you so much, Dr. Khan. That was amazing. That was absolutely amazing. I particularly enjoyed the part, the way that you kind of tiptoed around the vaginal tightening and it being enjoyed by men and used by women. For me, when I first heard about Virgin, I was just amazed at the fact that so many women are going through a lot of problems in silence. A lot of women, only when I got involved in IMMERI, I realized that it was really, really a major problem that many women face in silence. And I'm so happy and I'm so grateful that we have our innovative, patented Virgin that is the solution for so many women that have been suffering in silence. And so what I would like to do now is I would like to now allow our members here. I know that we have 76 people on. We just crossed 61 members here in Trinidad and Tobago. Amazingly, in just like a few weeks, we're up to, I'm sure we're going to be hitting 100 people here in Trinidad very, very soon. So we have a lot of excited men and women here in Trinidad and Tobago. And so what I would like them to do is, I'm seeing some questions popping into the chat box. If it is that you would like to unmute, it's okay if you want to unmute and ask Dr. Khan your question. If not, we'd read it from the chat box. All right, so let me just make sure that I can see. Right, I think I can see, I have the right views, speaking view. We go full screen. Right, I think I'd be able to see now. So if it is that you have any questions right now, okay, let me look down the chat. The first question I'm seeing here, what causes a burning, itching feeling when you first start using Vagine? From Miss Alicia Danielle.
All right, thank you, Mr. Brian. And this is also a very good questions. And in fact, this is one of the healing crisis or the reactions that most of the users experience. And you know, whenever we have this burning or this itching sensation, most of the times it happens that what happened is that, sorry, I accidentally closed. All right. What happened is that, all right, what happened is that this bacteria and virus, bacteria and fungus that actually stay together. So whenever we use a Vagine, it will inhibit the bacteria faster, relatively faster than the fungus. All right. So when we first use the Vagine, it will suppress the bacteria, and in a way, it actually trigger the fungus to act more actively. And that actually trigger the itching sensations, but it will not last long. Once the pH is being regulated, once it go back to the right pH, the itchiness will disappear. All right, so this is one of the common reactions, and whether or not it can help in a fibroid, and I'm sorry to say, we don't have studies on a fibroid. If you are speaking from this the scientific manner, I cannot say this Vagine can help in fibroid because I don't have enough data to prove that. But we do receive some testimony whereby, you know, after using Vagine combining with the V-type, it shows a very good improvements in terms of fibroid. Yeah, because I believe fibroid is also very common in Trinidad. And also, let me just also answer another questions about PCOS, because I know that PCOS is also very common in Trinidad. And again, the cause or the pathophysiology for this, you know, the cause for PCOS is very different. It is not really caused by the bacterial infections, but we also do have many testimony, particularly in Philippines. If you still remember the slide that I showed to you about this clinical study, we did that in the Philippines with this doctor by the name of Dr. Glenda. And in fact, she also gave Vagine to some of the PCOS patient, all right? And the interesting part is that it also show improvements in PCOS patient. I don't have a scientific data to prove that, but we do have testimony on that, all right? So in fact, let me just add on, for PCOS, if Vagine is to use together with another product called Femtima, so it will work best because PCOS has something to do with the hormone, and Femtima or Cachifatima is actually helps to regulate the hormone. So if we combine these two, it will give a very good results. Okay.
Wow, awesome. Seeing Amanda Morris saying very informative. Thank you, Dr. Khan. Taras is saying, oh my goodness, this presentation was amazing. Can we have him back soon? Yes, we'll have Dr. Khan again very soon. As long as we keep growing the community, as we keep growing our business, bringing more people into IMMERI for sure. Does Vagine affect your child's birth control? Sorry, I read that wrong. Does Vagine affect your birth control? From Nadine Evelyn.
All right. No, it will not. It will not. Actually, you see, what Vagine does is to restore the natural defense system in a woman. meaning that it just put everything back into normal, in a normal state. So it will not affect your birth control. It will not affect whatever you have done, externally. In fact, for those under birth control, particularly for those using this IUD, so this intrauterine device, most of the times after using IUD, they tends they are very prone to this infection, because when you use this IUD, it's actually in a way affect the ecology in the vagina. And in fact, if you have that problems, using Virgin can helps to reduce all those symptoms. Okay, so don't worry about this birth control. If you are taking this birth control pill, it will not affect the efficacy. All right.
Awesome. So Maria Danielle says this info is very profound. Safia says very informative. Thank you. Awesome presentation from Miss Mona Jones. Very educational and informative. And of people asking, a lot of my people are asking about fibroids from Maria Danielle. So you just answered that. Can it cure PCOS? Can it cure PCOS?
No, it cannot cure. As I said, it can help to improve, but it cannot cure, because this is, after all, this is only a supplement. I mean, yeah, this is not a drugs, so we cannot say cure. But as I said, once you restore your system, it will automatically helps to repair certain disorder in the body. So it will help, but it cannot cure.
Awesome. I'm seeing another question from Malika Thomas. Hi, good morning, Dr. Khan. If the person has no major issues, how often a month should you use Virgin?
All right. Generally, our general recommendation is that, for the first time user, you use Virgin every day for 2 weeks, which is 12 days. All right. So right after that, you can use on alternate day, which means in a week you can use 2 to 3 times or 3 to 4 times as a maintenance alternately. So that is for general maintenance.
Awesome.
Okay.
Awesome. I'm seeing Logan says, sorry, I came in a few minutes late. Can you tell me the cost of this product? The suggested retail price of Virgin locally here in Trinidad and Tobago is $400 TT for 6-pen applicators. There are 6-pen applicators in each box, and we retail it at $400 TT. When you get started as a member, we pay generally between $250 to $300 TT is the cost that it costs a member. And we retail at $400 TT. Tricia says, I learned a lot, very interesting. Thank you, relieved to hear that, says Nadine. Lisa Dyer raised her hand. Lisa Dyer, you want to raise your hand? Let's see. I'm seeing another one saying, so proud to be a part of a revolution to improve the happiness of mankind. We're so blessed. Yes, we are. Anthony Teddy Lafont. Jerome says, can a pregnant woman use it as long as she doesn't insert it up too far?
Well, this is also a very good questions. Let me put it this way. Virgin is safe for everyone, even the pregnant lady. But the problem is that for every pregnant lady, especially during the first trimester, which is the first 3 months, the pregnancy is very unstable, which means anything can cause a miscarriage. So that's the reasons why we don't usually recommend to the pregnant lady, because sometimes if it so happen that when you recommend Virgin to this pregnant lady, it may not caused by the Virgin, by other factor, but so happen something happened, so it will put blame on the product. So usually we will not recommend to the pregnant lady, even though we know that the product is safe for the pregnant lady. So yeah.
Awesome. Anna says, vital information. Thanks, Dr. Khan. A lot of great information. Loving it. Miss Amanda Ballantyne, who has an amazing testimony, says, can a virgin use Virgin?
Okay. Can a virgin use it? all right, you see, for virgin, of course, you can actually put on the outer layer. You can just put on the outer layer without inserting it. But I have to be honest with you. If you're looking for the optimum effect, definitely inserting is the best. But of course, if you are a virgin, so you can still apply on the outer layer. But to be frank, it may not give an optimum effect. It depends on the severities of the problems. If the infections is very not so major, it's not very severe, definitely it will help. But if, let's say, the problem is very severe, so you may need to look for other way. Because I came across these questions from a doctor in this Ghana. I just share with you. When I was once in Ghana, one of the doctors also asked me the same questions. He said his sister who is a virgin, but with a very severe this bacterial vaginosis has been lasted for a few years. And he asked me the same questions. I said yes, you can apply on the outer layer, but it's up to you to decide whether or not to use it internally, because if you are looking for this optimum efficacy, inserting is the best way. But if your problem is not that severe, on the outer layer it will still give results. All right.
Awesome. Seeing is the presentation taped? Yes, we're streaming live also on YouTube, and so the YouTube link will be made available. Amazing, so much information. Can it be consumed orally? From Lisa Dyer.
I missed this part in my presentation. I know this is one of the frequently asked questions. I think this is very important for the gentleman. Yes, virgin is edible. All right. So of course, we will not recommend you to take it, orally. But if, let's say, accidentally you eat it, it is still safe. And don't ask me how this virgin go into your mouth. I believe you understand that. But don't worry, it's still safe because it's made with all the natural ingredients. So it's edible. It's still safe. All right.
All right. Awesome. I know that many people are starting to use their imagination, Dr. Khan. Rosemary is asking, can someone who did a hysterectomy use this product?
Oh, yes. You see, if someone undergoing after this hysterectomy, no doubt they may have removed their uterus, and other parts in the reproductive system. But the thing is that for those patients after hysterectomy, their chances of getting infected are even higher, because once you remove the organs in the reproductive system, you actually, in a way, alter the ecologies of the system. So by using this virgin, it helps to balance the system. And maybe you will ask, how do this virgin travel up to the, being absorbed if you have taken if you have removed your organs? Don't worry, it's actually absorbed through your blood vessel. So no matter whether or not you have your uterus or other part, it will still be beneficial to the patient.
Awesome. Okay. Awesome. Ms. Mona Jones asks, won't it cause a virgin to feel sexually active? I guess.
Well, yeah, you see, this is also I would say, the side benefit. If this is not a aphrodisiac product, it will not stimulate your desire, because this is not a aphrodisiac product. But I do receive some testimony from the user. Some of the wife actually did tell me that after using virgin, they have this increase in libido, partly because of the hormone, and perhaps it's also you have long, how should I put it, after using virgin, you feel fresh, and that could be the reasons why you want more. Okay.
Dr. Khan, you're great at these questions. you're getting red all over. I can see you getting red. Can a teenager, Trisha is saying, can a teenager use it?
Oh yeah, just on the outer layer. Just bear in mind this virgin, it still has this antibacterial property. So for a teenager, or the same questions go to for virgin. So you just apply on the outer layer. And in fact, for the teenager, usually the infections usually is not very severe. So applying on the outer surface will definitely be beneficial to them.
All right. Jerome is asking again, okay, so after the first trimester, is it okay?
Well, technically, yes. In fact, according to our studies, if you were to use virgin a month before delivery, it will actually benefits to the baby, because when this baby the pass through the vagina, if you have sufficient of good bacteria, it will actually in a way give a better immune system to the baby. All right, so if you were to use, you can use it 1 month before the delivery. But again, as I said, every pregnancy there's always a risk. I just don't want to put you on risk, because if anything happens to the pregnant lady, so definitely they will put blame on you. So I don't want I don't want you to have that risk. So usually we don't recommend to the pregnant lady, unless this is your wife, or this is someone that you have confidence in, or they have confidence in the product. That is different story.
I believe I think he's asking this question because he knows of someone who is pregnant right now, but she has a severe infection, and so he's trying to find a solution for her.
All right.
Star Paul is asking, can you use Virgin while on your period?
No, you don't have to use it during your periods. What you need to use during periods is another product offer, which is the sanitary packs. Sanitary packs, because it's a kinds of ways when you use virgin during the periods, because you're still discharging the blood, so it will still neutralize the alkalines your pH. So we use it after or before the menstruations. Okay.
Awesome. Samantha Ballantyne is asking, what age group can use Femtima?
What age group?
For Femtima.
Okay. Anyone above 16 years old. once they hit the puberty, once they have their menstruations, they can start using Femtima. Yeah, in fact, Femtima is actually very common in Southeast Asia. This has been used for centuries as a natural remedy to helps to balance the hormone. So once you have your menstruations, you can use Femtima. Even after menopause, you can still use it. In fact, after menopause, you need it even more, because there's a decline in the hormones when you hit the menopause. So it helps you to get rid of all the discomfort.
Beautiful. DJ Medford, I know that you answered this already, but he asked, how often do you use Virgin? So do you want to say one more time, Dr. Khan?
Okay. So the recommended usage. All right. So if you are the first time user, use it once a day for 12 days, 2 weeks. All right, for 2 weeks. After that, you can use 2 to 3 times per week as a maintenance.
Awesome.
All right.
And we also have Vanessa saying, oh my, this is so awesome. I learned a lot tonight. Thank you so much. You're so welcome, Vanessa, and thank you for joining us. Recently got started with us here at IMMERI. Yolanda Marcel says, why is there no clear guidelines on instructions on the box? I think we have it in PDF form that we sent.
Yes,
but over to you, Dr.
Yeah, correct. Because this, we want, as I mentioned by Mr. Brian, we have the clear instructions in our PDF. We don't put it on the box because we want you to really talk to the user. Because if you were to put on the box, they can buy it back, and without knowing the right method, they may not have the optimum the effect. So that's the reasons why we don't want to print it on a box. So we want you to, you know, talk to them, teach them, really let them know the benefits, really, you know, guide them how to use so that they can get the optimum or the maximum benefits.
Awesome, awesome, awesome. And seeing Jerome is asking a different question. Jerome, we're going to get to Alihad. We're focusing tonight on our vagine. We're focusing on vagine tonight. So we'll talk about Alihad. We'll have Dr. Khan come back and do another session with us on Alihad. Onika says, I missed out a lot. I was asking a question, how often you use vagine? Yes, Dr. Khan just answered. All right, so Jerome, we'll get to that questions on Ali, your questions on Alihad, and the next time that when Dr. Khan comes, so that comes to spend some time with us. So, ladies and gentlemen, are there any more questions? If anyone would like to say anything, if you would like to thank Dr. Khan, just raise your hand. We'll unmute you, and you can share with Dr. Khan, you know, how you feel about your IMMERI journey so far. You'll be talking to Mr. Michael Ong, a very, very awesome. He's the manager, he's the coordinator of our IMMERI International, all of our operations. I want to give a big shout out and a big thank you, because he was the one who was very instrumental in getting Dr. Khan here for us tonight. And so I want to thank Mr. Michael Ong so much for arranging tonight's presentation with Dr. Khan. So let me see if I'm seeing one hand going up, and I'm seeing what will you recommend for men? That would be Alihad, and 1 a day, 2 weeks at the beginning, 3 times a week after 2 weeks. Okay. All right. So I'm seeing one hand, Nicole Melville. All right. So I'm just going to ask you to unmute. I think you can unmute now.
Yes.
Right. Go ahead.
I heard that Dr. Khan was saying, I'm asking about the polycystic ovaries in a 17-year-old. What would he recommend then that the person use?
17 years old.
17 years old and has PCOS.
All right. For PCOS for 17 years old, I think what she can do is only Femtima. She can try to use Femtima, because you know, if you were to, for 17 years old, you know, using virgin may not be that appropriate. Of course, as I said, you can still apply on the outer layer, but the problem is not on the infections, I believe, it's on the hormone. So the best for her, I believe, is Femtima, because Femtima, you know, helps to regulate the hormone. So probably she can try Femtima.
Awesome. And we have Mr. Ralph Johnson has his hand raised. Mr. Johnson, go ahead and unmute.
Yes, good night, everyone. Good night, sir. I'd like to
Mr.
thank
Johnson.
Dr. Khan for all the information, because he really cleared up a lot of things, I think, not just in my mind, but in the mind of a lot of our people who are involved in this company. And he also helped a lot of the ladies to understand what this vagine is all about. And I want to thank you, Mr. Louis, because you always have foresight. You always seem to deal with issues before they arise. So you got Dr. Khan here to answer these questions so that we'll be more confident going out and dealing with the public, especially with a new product. So I just want to say thanks to Dr. Khan and thanks to you, Mr. Louis, for putting together this call for us. We really appreciate it, and we appreciate everything you do for us. Thank you so much.
You're most welcome, Mr. Johnson. We're always happy and grateful to serve here at IMMERI. All of the leadership here at IMMERI have one thing in common: service to others. You know, and I'm so grateful myself for Dr. Khan and of course Michael Ong for setting this up. It was really amazing. We have Mr. Anthony Lafon. Anthony, go ahead and I'm going to make you co-host so that you can unmute and please share.
Pleasant and warm welcome and good evening to all. Oh my gosh, Mr. Louis, we appreciate you so much for your vision, as Mr. Johnson said, for being such a dynamic leader and such a humble human being in your genuine way of just wanting to help others. Dr. Khan, we give you a warm welcome here in Trinidad and Tobago because I don't think, I can say, this far, all members in IMMERI, Trinidad and Tobago, we are ecstatic with excitement and awe and eagerness to push this business. But tonight, this is a reinvestment of the belief in your product, the belief in your company, and then it gives you a better understanding of your purpose because we are chosen ones here with a revolution, as I said earlier, because the world don't know yet how much they need this. It hasn't even scratched the surface, and I am bursting with excitement again today. My wife and I was talking about it, and she's a very hard nut to crack in getting involved in these type of things. Mr. Louis and Mr. Johnson can attest that themselves, you know. And I just wanted to say thank you so much for this sort of information and support, because now we have even a stronger base that we could advise and let people know what they have as value. This has even bring more value to the company and to what we have here at IMMERI. And I just want to say, on behalf of my wife, Nadia, and I, we thank you so much. We are forever indebted to you all to just make this work for so many people. Thank you.
Awesome, awesome, awesome. Most welcome, Teddy. Most welcome. That's so awesome. I'm seeing another question coming in. Do you use Vagine in the day or in the night?
Oh, at night before bedtime. Yeah.
All right. And Mrs. Charlene Johnson, Dr. Khan, this is a wonderful product. So we have many people here. I'm so grateful that have warmly accepted Vagine and IMMERI, and very excited now. I can feel the level of excitement because one of the things that happened to me when I was in Africa, I came to the realization that every woman needs Vagine, not just women that have an infection. Every single woman needs Vagine. And so with that, if there are no other hands going up, if there are no other questions, then I'll just pass the mic over to you, Dr. Khan, to just leave us with some parting words, maybe something that you would like to share for the 78 participants here. Like I said, I know that we have guests on because so far in just a few weeks, we've just crossed 60. So we're just a little bit over 60 people that have said yes to IMMERI. So happy and so grateful here in Trinidad. And so I know that there are guests on as well. So if you would like to share just a little bit of information, a little more information, parting words, parting thought before we wrap it up.
Right. Thank you, Mr. Brian. Thank you, everyone. It's my honor to be here, and I feel very excited too after even doing the presentation, looking at your response. And thank you so much for having me. And you are actually motivating me to move further. As I mentioned by Mr. Brian, IMMERI definitely, especially this Vagine, is definitely a good product. Our mission is actually to make every woman, every family to be happy again. I still remember when we had our launching in Ghana. The Minister of Health, he did mention about one woman, one Vagine. That is also our missions. We hope that with this amazing product, we want to change our people life. We want to not only to make them happy again, we want to also change the every happy family, especially for those having this this marriage crisis. Definitely, I believe this with the introductions of this Vagine, it will in a way save their marriage, and most importantly, by doing this business, it will also change the life of the people around us. So let's work hand in hand, try to promote these products to every parts of the world. And thank you so much for having me. And oh yeah, one question that I missed. I think I missed one question just now. Someone asked me about whether or not this product will stimulate this desire in the teenager. It will not, as I said, it will not stimulate the desire. It will only helps All right. So let's work hand in hand, and thank you again. So I hope we can meet again, and thank you so much, and stay safe and stay happy. Thank you. Over to you, Mr. Brian. Thank you so much.
Oh, wow. Thank you so much, Dr. Khan. This was amazing. You know, I'm always I listen so attentively whenever you're on, because every single time that you do any presentation at all, you always drop just a little bit more information, things that will change, of course, the information that we're getting all the time about our amazing Virgin. And again, I want to thank you so much for taking the time, for getting up early, a little extra early, to spend this time with us. And just know that it is going to go a very, very long way. We look forward to having you here in person, live in Trinidad and Tobago. We will definitely make that happen yourself. So pack your swim trunks, because you will definitely be here in the Caribbean, in Trinidad and Tobago. We're blazing a trail, and we plan on doing major things out of this little country, you know, making a definite mark on IMMERI. So again, I want to thank you so much for being here. Thank you to Mr. Michael Ong for making this happen. And of course, all of the IMMERI corporate staff that are doing so many things in the background, making sure that we have an amazing experience here at IMMERI. And so, ladies and gentlemen, I want to thank all of our guests and all of our members for joining us tonight for our seminar with the amazing Dr. Kan Kok Ming, who is the director of IMMERI Growth University. And so with that, ladies and gentlemen, as we always say, we stay happy and we stay simple. And as I always say, the future belongs to those who believe in the beauty of their dreams. And so I encourage you to keep on dreaming and keep on believing, because the best, ladies and gentlemen, is absolutely yet to be. Good night, everyone. Good night. Well, I should say good day, Dr. Khan. Have an amazing and wonderful day. I'll be sure to send you the recording as well as all of the chats, because I'm seeing the chat still popping up. I'll send you the chat file as well. Thank you again for being with us tonight.
Thank you. Thank you, Mr. Brian. Thank you, everyone. Good night.
And have a good day. Good night, everyone.
Good day to you. Bye-bye.